Hello and welcome to my presentation. I'm Mary Petrani and I am a Master's of Nursing practicum student with Dr. Janice Hill, and today I'm going to be talking to you about my practicum project with a patient advisory board proposal. So who are we as an organization? Well, we are a cancer center in the West Valley of the Phoenix area. We have both inpatient and outpatient oncology services. We're not for profit, and we're part of a national cancer center network that spans from California all the way to the East Coast. Our values first include our mission, which is to make hope a reality to all touched by cancer, and then values of trailblazing, compassion, inclusion, and integrity. Compassion and inclusion particularly relate to this project as it involves including patients not just in decisions for themselves as individuals, but for processes at our organization that affect multiple and/or all of our patients. Further, this matters to us because part of our strategic goals for the organization, the Phoenix Pillars of 2024 to 2026, include developing processes to increase patient and family involvement in quality improvement initiatives. So the first step was looking at needs assessment with our organization. So I did this by looking at the community needs assessment that was completed for our organization in November 2024. From looking at this, I figured out that the top 3 health needs of the area in our community identified were mental and behavioral illness and substance use, chronic disease, and cancer. The top 3 qualitative results identified included perceived medical discrimination, distrust of healthcare overall, and issues with access for physical health and pharmaceutical services. How best to address these needs? We are already working as a community cancer center to address one of the top 3 health problems facing our community. But what else can we do? How do we work to address these qualitative results? How the community feels about healthcare and health facilities in general. So we plan to do this by creating a patient advisory board. A patient advisory board is made up of patients and caregivers or family and is utilized to gain perspective and insight from the patient side of things on various topics, initiatives, and processes. So patient board members are asked for their opinion and insight on the different areas. Patients are also asked to bring forward ideas they have for new or improved processes. Coming together in the Patient Advisory Board to collaborate on different initiatives and innovations to further improve our patient care processes and outcomes. So what does the evidence say? I did a literature review and found that patient advisory boards are a common ground for all 6 aims of quality care as defined by the Institute of Medicine. This includes patient-centered, safe, effective, timely, efficient, and equitable. Facilities with patient advisory boards are also significantly positively associated with patient social needs being screened for, more aspects of social needs being addressed, more partners to help meet the needs of these patients. And patient advisory boards not only give feedback on patient experience, but give patient perspectives on policies and projects and ensure patient-facing materials are easily understood by our patient population. Further, patient advisory boards can help with equalizing disparities and overcoming issues related to social determinants of health. Patient advisory boards are feasible and productive for both patients and staff, can provide clear and open communication, allow for dialogue between patients and staff. 75% of patient advisory board members polled in one study in Norway said the organization as a whole was strengthened when a patient advisory board existed. Then over half said that policies and practices were improved once a patient advisory board was put in place. And over half also said that the culture became more interactive when there was a patient advisory board. So a lot of good evidence as to why a patient advisory board can be helpful. So once we did this, I looked at my project timeline and what seemed feasible, but aggressive enough that we could stay on top of it. So first was the pre-work with the community needs assessment I did and looking at the potential interventions that were done. And that was due by November 15th, which I was able to get done. Then we had project finalization and approval, where we had to get approval from the executive leadership team, patient experience, executive director. I completed the literature review to help provide information before a determination was made if they would approve or not. And that was due by the end of November, was taken care of. Education development was looking at synthesizing evidence from the literature review and looking at how a board can meet community needs and how it can fit our organization's strategic goals for patients. Then talked about formatting the different flyers and handouts and electronic versions of flyers, and identified an executive leadership team sponsor for project guidance. This was due by December 20th. We were a little behind on that with the holidays, but still got it done by beginning of January. Then in January, due by January 20th, was developing a team, engaging marketing team, employee resource groups, etc., different areas that would have people that could potentially be interested and have helpful insights in developing this. And then once we had that completed, community education started, where I worked with marketing to advertise to patients in the community. We used verbal, written, and electronic communication, and advertised the board position openings throughout the organization. And also, I've been asking providers for referrals due by January 31st. Done. Then developing the board structure and guidelines was due by February 14th. And this has happened. We completed a review of best practices. Then I decided on member term limits, orientation and guidelines. Bylaws were created, identified priority issues to address, and planned budget and time for time and resources. So this was done with the help of the ELT sponsor and my preceptor. Then due by March 7th, which we haven't quite got to, we're in this section now, is interviewing board candidates, creating application for interested candidates, etc., and then having them fill out the application and then going through those and doing interviews with the implementation team to see who might be a good fit. So the goals of this patient advisory board are to have the patient voices be heard, to increase engagement with our community and our patients, to build rapport and trust, help improve their belief in healthcare at our facility, show that we're invested in the community and our patients, and actively listening and engaging them in decision making, which we're doing with this board. It helps to increase trust and strengthen community bonds as we do these things, because they see then that we really care about them and we want to know what matters the most to them. So this will not only show us to be a leading healthcare advocate of patient engagement and voices, but that we're committed to our community and helping with the identified community health issues. It's also an important way to meet the organization's strategic goals. Anticipated outcomes we are going to measure by surveying the Patient and Family Advisory Council, or PFAC, members, then also looking at patient satisfaction surveys. So we're going to evaluate patient satisfaction surveys in a pre-test, post-test design, looking at those that were filled out before the advisory board was brought into fruition, and then after, to see if there's any differences. And we're also going to do that with a survey specific to the advisory council members that they will fill out before and then measure at baseline and then after the intervention at 3 months, 6 months, 9 months, and 12 months. The results we anticipate is an increase in patient satisfaction scores and an increase in satisfaction and engagement scores of our advisory board members. Stakeholder reception to this has been really great, all the way from our executive leadership team down. So the president of the Phoenix Cancer Center himself sent me an email stating support after this was presented at the executive leadership team, and our patient services vice president and chief nursing officer has been a huge support and is our ELT sponsor for the project. And then within nursing leadership, the professional practice director at Phoenix is in charge of education, magnet program, and continuing education for our clinical staff, particularly our nurses. And she was my preceptor, so definitely I had her buy-in and she really helped a lot. And then we had our quality and risk management director from the Phoenix site, who had a different perspective to help us ensure that we maintain patient safety and complied with all rules, but that also they could help bring forward some potential issues that can be addressed by the council. Patient engagement team from the executive director to the cancer fighter volunteers and director, down to patient engagement specialists on our site, from the whole overall organization, have been incredibly helpful and incredibly supportive. And then our clinical staff, our social work team has gotten involved. We have our outpatient clinic team as well as our inpatient team that should both be paying attention to this, because we want to hear from both patient sides. And then also our self-governing council, this is a good project to bring forward there, so they're aware of what we have available. So what are the next steps that I'm going to take to ensure that this is taken care of properly? The interviews need to be finished. Review applications, schedule 20-minute interviews, at least 3 to 5 members of the interview team present for each, which we've done so far and want to continue to do. Selection will be 6 to 8 chosen out of those that are interviewed. They must be a majority agreement of the interview team, and the executive leadership team must approve. With communication, we're going to choose a designated communication lead from the team who can contact all the chosen employees, send welcome emails, and keep a contact list of the council members. The inaugural meeting will be scheduled based on availability of the majority of the council members, because we want them all, as many of them as possible, to be there. And we will organize agendas based on safety and quality topics that our safety and risk team have brought forward, and we will include the appropriate staff alongside these council members to answer any questions they might have. And then in terms of sustaining, the plan is to have monthly meetings where there's at least 10 a year, so there's a little bit of room if there's an issue. And surveys will be done, they will be completed before each meeting. So for me as a student, my experience with this really taught me a whole lot for my professional goals and my AONL competencies. In terms of my professional goals, my top goal that I think we all have in this class is to become an advanced degree prepared nurse. I also want to continue to work on nursing research and evidence-based practices and implementation of those, gaining experience in presenting to leadership, which was a little nerve-wracking, but not as scary as it could have been, to increase my patient advocacy. I work really hard. I'm thinking about the patient at all times, just like we all are. So I want to increase my awareness of that in all I do, and focus on community health needs, because we are a part of the community. As regards to AONL competencies, I used for professionalism, just culture, advocacy, health equity, patient representation to the executive teams. For communication and relationship management, there was transparency and interprofessional collaboration between different team members, myself and others from different departments. Healthcare environment knowledge, obviously that's going to be evidence-based practice, EBP, and aligning with the organizational strategies. Then the business skills and principles include human resource management, knowing how to deal with teams so that you can be effective in creating change with a project, strategic planning for your projects, and financial management. And finally, leadership as a whole. You should be transformation and innovation should be coming through, and it really did with this, and change management as we're going through adding this on, and then of course evaluation and analysis to see what's working and what isn't. And finally, my student reflection. In terms of lessons learned, I found that approvals take time. There are multiple layers and departments involved in getting leadership approval for any project. Why might this be? And I believe that it's because of caring for the patient and their safety, and ensuring that everything has been vetted appropriately. Leaders are everywhere. They're not just in management positions. They're executive directors as well, but they're frontline staff who observe and pay attention and suggest things, and even just on their own in their own practice are innovating and being a leader. And if you stop, you can get some great ideas for your projects by just listening to and observing your fellow coworkers. And then in terms of surprises, I found that no matter how well you plan, evidence-based practice and quality improvement projects are in constant evolution, because something is always going to change, something's always going to shift. And so you need to make sure that the team you have with change agents and champions is aware of that and doesn't get off track because of that, and just rolls with it, because this is going to constantly evolve to become better and better. In terms of surprises, I found out that if you're willing to do the work, you often are given greater autonomy than you thought. Having an ELT sponsor for your project is enormously helpful as well, because they can use their influence and their authority to encourage others to support and participate in the new challenges that you might have facing this change, and to give feedback for continual improvement. And then my final note is, for the future, don't be a hero. Ask questions and ask for help. It doesn't make you weak. It doesn't make you incapable. It makes you smart when you ask questions and ask for help, because nobody can do anything entirely alone. And then here I have my resources on the next page. So these are my references, and I appreciate your time as I reviewed my Patient Advisory Council project. Thank you and have a great day.